Well, there are many medical conditions that people associate with a certain age. Take, for instance, heart disease and stroke. Well, most people think that the typical patient would be in their 50s or beyond. Well, that's simply not the case. So during Stroke Awareness Month, the Heart Association is hoping that everyone will realize the warning signs while taking the steps to prevent it. We have Dr. B.J. Hicks joining me today, along with stroke survivor Kristen Fritz. Thanks for being here, both of you.
Thank you.
Thanks.
So, Kristen, simply by looking at you, I don't think anybody would think you fall into this stereotypical kind of stroke survivor. You don't have any of the things that we would think of naturally. So I want you to tell us your story, how you had a dealing with a stroke.
Thank you. Yes, so I was 38 years old. It happened back in 2012. I was at work. I work in an office situation. I had gotten up to go to the copier, and I felt myself kind of dizzy, couldn't focus. The room felt like it was spinning. And a few minutes later, I started getting some tingling in my left arm. The squad was called, and they came, but they couldn't really figure out what was going on because all of my vitals were normal, blood pressure and everything. So I chose to go to the ER myself and spent several hours in the ER. Again, they couldn't quite figure out what was going on with me, but went ahead and admitted me, and I spent the night. Next morning, I had an MRI, which showed that I actually had a stroke.
Wow. So this is something that even the health professionals didn't necessarily recognize in you.
Right.
Were you hearing a lot of things like you're too young, it couldn't be that?
The stroke never even came up when I was in the ER. It was, we think you're having a migraine.
Okay.
Sometimes when you have severe migraines, you can have tingly. While I was waiting in the ER, by that time, my whole left side, all the way down to my feet, had the tingly and numbness feeling. And then while I was waiting, I started to get a severe headache. So, and I had migraines in the past, and I was just like, I don't think that's it. But they did admit me, and then the next morning, they figured it out.
So at that point, you're 38 years old. How are you doing now?
Oh, I'm great. I was very lucky. My stroke was very minor. I tend to have some numbness and tingling in my left arm occasionally, more so when I work out. I can feel it. But otherwise, I'm really doing great, and I'm very lucky.
Okay, and we're very happy to see that. So, Dr. Hicks, how often do people overlook warning signs, either themselves or even if they go to the hospital, much like Kristen did?
Unfortunately, it happens too often, and that's part of what we at the American Heart Association, American Stroke Association really strive to do, is empower everyone to know the warning signs and be an advocate for yourself and for your body, regardless of how old you are.
And let's go through some of those key symptoms. You always have that acronym, FAST. So go through that checklist. Tell us what people need to be looking out for.
F is for face. That's with facial weakness or numbness, tingling. A is for arm or leg weakness, commonly, or numbness, like what Kristen experienced. Speech is change in speech, slurred speech, or difficulty getting words out, or just confused speaking. And then T is for time. It's not time to call your mother, your father, your sister, your brother. Don't call your doctor. You dial 911. And in some situations where it's not crystal clear that a stroke is happening, like it was with Kristen, or if the age doesn't quite fit that stereotypical 50 to 60s age range, you still need to be an advocate for yourself, because my patient population encompasses the entire spectrum. Stroke does not have an age range that is just crystal clear. It could be anyone.
And when somebody gets to the hospital, when they have a stroke, when they're recognizing these symptoms, how important is that to get immediate help instead of waiting and saying, oh, is that what I had?
The adage that we use in my line of work is time is brain. And that's what's always on my mind whenever a potential stroke patient comes in the door, or whenever I'm asked to see a patient in the emergency room. 2 million brain cells are lost every minute on average that someone's having a stroke.
Wow.
So the quicker we treat someone, the better the patient does. We're all very thankful that Kristen's symptoms were minor in the grand scheme of things, but I have patients that share her same risk factors for stroke that didn't have as sunny of an outcome, to be frank.
And 80% of strokes are preventable, so that's the key we want to tell people, right? There are things they can do to prevent a stroke.
Smoking is a big one. Blood pressure is extremely big. These are things that you can know yourself and try to implement ways to take care of. You have to know your numbers as far as blood pressure is concerned. It doesn't hurt. So, you know, in my line of work, we call it the silent killer, because you can go about your life and not know that your blood pressure is far too high. So these are two things, the smoking and the blood pressure, that we really encourage patients to have a good understanding of and try to take measures to normalize yourself and lower your stroke risk.
All right, and Kristen, we are glad to see you here and that you're doing so well. Thanks for sharing your story. And Dr. Hicks, of course, for giving us all that good info. Much more on the American Heart Association website. So thank you both again.
Thank you.
My pleasure.